As I told you, the patient complains of pain at the end of collarbone. See, this is your clavicle. When you palpate the clavicle, at the end of the clavicle, the patient complains of pain. So during the practicals of PT Ortho, each and everything what will be there, it when we ask. Don't think that you didn't told in the practical. So please listen it carefully. If any doubts are there, you can ask me. The patient main complaint will be when they palpating the clavicle, at the end of the clavicle, this is our AC joint. So the patient will complain pain at the end of the collarbone. So that is one of the main clinical feature what the patient will tell. Can you show the next slide? So this is what I showed you. When I ask the patient to see, when you are comparing both the clavicles, the clavicle which is on the affected side, it will be less. Only the clavicle. Only the level of the clavicle will come down. We are inspecting it. Next. Next. This is the special test. If the patient complains of pain in the end of the collarbone and the history like he was telling a forearm outstretched hand, the special test is acromioclavicular joint compression test. Means patient will be in sitting position, therapist is next to the patient, take both the palms and apply light pressure and release. AC joint compression test. Just do the compression, any pain. So usually normal and just go into any pain because it is normal. If there is any sprain is there, when you do this, see, don't apply too much pressure, just a mild pressure and release it. So the patient complains pain means the test is positive. Next. So the taping technique I will tell later once you complete the knee joint. Next. Yes, next. So these are the movements I told you which are useful to increase the mobility. Patient will be in come to standing position. These are the called as pendulum exercises. Means ask the patient to bend forward, okay, make it light, okay, and do come little bit forward, and make the arm free, okay, and move forward and backward. See, they should not do tightly like that, okay, bend forward and do this, do it. So this is pendulum exercise to improve the range of the motion, or ask the patient to do clockwise movements and anti-clockwise. Can you do 2 times in one direction and again 2 times in opposite direction? Clockwise and anti-clockwise movements. So mainly these are useful to improve the mobility of the joint. Next. This is what I told you, external rotation stretch. Can you come to life? Supine. So in the practical speed, completely. So in the practical speed ortho, everything will be on patient only. One will be the model and we will ask the patient to demonstrate. So you should be in a position to do any type of exercise or any stretching exercise. External rotation stretches, patient will be in supine lying position and we will do the external rotation, okay, and we will stretch it. Can you show me which muscle is stretching? Which muscle is stretching? He's acting like a real patient. See, this is external rotation. Usually the muscles come, everyone come to near close, please. You can't able to see when you are sitting position. Relax. So the external rotation stretch, patient will be in external rotation, okay, and do the stretch, keep it here, okay. Which muscle here? Triceps, then it was any other muscle? Even? Serratus. External rotation stretch will be, ask the patient, please don't disturb him. If you are disturbing, I will make them as a model. You won't be as a model? And don't disturb him, okay. So external rotation stretch mainly to decrease the tightness in the triceps, pectorals and the serratus. This is for the AC joint. Next.
External rotation?
Not internal rotation, just external rotation stretch. And external rotation and internal rotation with the help of TheraBand. Can you come to sitting position? Yeah, actually most of the muscles, the external rotation, internal rotation problem will be. So what we'll do, we'll do with the help of TheraBand exercises.
الله اني احطه قبر شنو اقول يا ظاهر ولا حطها كذا هزك
انا مش